investigator in the study?
Provide medical care to the subjects.
Yes, absolutely. They have to provide proper medical care to the trial subject.
And also monitoring and auditing of the records.
They have to provide the permission to do the monitoring and auditing of the study records.
Communication with
Whatever the study related information which they have to communicate with the ethics committee, like any submission of any study related documents or any notification of study related documents, it is the responsibility of investigator to do to the EC, like to communicate with the ethics committee. Then
accuracy of
Conduct
record.
the study according to protocol.
yeah, they have to conduct the study according to the protocol only, approved protocol only. The study must be conducted.
Selection, recruitment of the subjects.
Yes, they have to do the selection of a subject into the clinical trial as per the protocol eligibility criteria. So what are the number of the subjects which they agree to the sponsor? They have to do the recruitment by using the different resources for it. Then
Obtain informed consent.
yes, obtain informed consent from the trial subject. Voluntary investigator have to give the study related informations to the subject, and they have to provide the opportunity to take their decision about the participation of a subject into the clinical trial. If they are interested, their signature have to get in the consent document. Then they also have the responsibilities, which is to provide a study progress report to the ethics committee in case if any study termination related things happened. Then they have to be informed to the corresponding authority. Then after, and also we discuss some of the responsibilities of monitor also, right? So who is a monitor?
Employee of investigator.
Is the link between sponsor and
Yes,
investigator?
the monitor is a link between the sponsor and investigator. So whatever the study related activities which is performing, which sponsor, which the monitor is checking, like how the studies are done, is it done as per the protocol GCP regulatory requirements, which sponsor is which the monitor is checking. So for that now they will do the regular visits at the site, like the monitoring visit they will be performed at the site, and also they will do the site selection visit. Then they will do the site initiation visit, site monitoring visit, closeout visit, like that different visits also which the monitor is performing during the study, right? So what are the responsibilities of the sponsor which is given in the guideline?
Investigator selection, SOP, submission to the review submission to the ethical committee.
Submission to the regulatory authority, prepare the contract for the study, provide IP related information, supply and handling of the IP, safety informations to do the reporting, monitoring, auditing. So like that, lot of responsibility. Our sponsor also having the clinical trial. So till this investigator responsibilities we studied, right?
Yes.
Okay, so
Yes,
here is
ma'am.
the guideline. It's given in the under the responsibility section. Three different persons, like three different responsibilities which they are given. One is the sponsor responsibility, then monitor responsibility, investigator responsibility. Then after that, it's starting with the next section. So this section, which is known as record keeping and data handling. Okay, so this is the which section? This is the fourth section, record keeping and data handling, fourth section. I hope my screen is visible for you.
Yes, ma'am.
Yes, ma'am.
Okay.
Yes, ma'am.
So the basic concept of this record keeping and data handling, which is to be record, store and transfer whatever the study related data which is collected from the trial subject. And finally, by using this data, we will prepare our clinical study report. Okay, so during the study, we have to do different patient visit, right? So and in this visit, we will do the different activities also. So can you tell me what are the activities which they are doing during the study? Like during the patient visit, what are the activities which they will perform? Do you have any idea? What are the patient visit activities that we will perform during the study?
The history of the patient.
History of the patient.
any side effect or adverse effect?
We will check about is there any, by using the drug, is there any problems our subject have?
Treatment is given to the patient.
They have to be give the proper treatment to the trial subject.
So the treatment is effective to the patient. That data is also mentioned.
Then
Reports.
Routine of a patient. Routine of a patient.
So whatever the activities which they have to do according to the protocol only, right?
Yes.
So do you have any idea what are the informations which we have to be doing in a study protocol? As per the protocol, what are the activities which we have to be do? We have to be do different patients visit, like screening visit, randomization visit, treatment follow visit, end of the treatment, safety follow, like that. We will do different patient visit. So here it's about giving some information which is about the documentation. Okay. So here it is given that what are the steps which is involved in the data management that should be documented, which will allow the step-by-step assessment of data quality and the study performance for the purpose of audit. Okay, so here in that now, what they have to be do, they should be have a proper SOP for it. Okay, they should be have a proper SOP. So here in the SOP, it should be contain the checklist. Then also it should be contain in the SOP, it should be contain the information that what are the activities which is done, then in which date or when the activities are performed, and the person who are responsible to do the activities. This information, it should be documented. Okay, so it should be contained an SOP, and in the SOP, it should be contained a checklist that can be used for our documentation purpose, and also it should be contain information that for every activity, who done, when done, and who the person who are responsible to perform the activity, that should be documented. Then there is another information which they are given. It's about the correction of the document. Okay, so correction of the document which they are given in our source documentation or in our CRF. There may be any mistake can be happen, or while you are documenting, there may be any error, there may be any mistake that can be happen. So it's here it is giving the information that how we can do the correction. Okay, how we can do the correction of the document which is given. So how we can do the correction of the document, I already communicated to you. When there is any mistake happen in a document, how we can do the correction?
Cut, sign and remark.
We have to be give a single straight line over the mistake. Okay, so all corrections in the CRF or any other study related documents, it should be made in a way that it does not obscure the original entry. So what is the first information which we are given in the documentation? It should be clearly visible. Okay, then also, so once you give this line over the mistake, then after that, the correct data we have to be inserted, we have to be documented. Then along with that, what we have to be do? We should be mention who done the correction. Okay, by giving the signature, we can give this information that who done the correction. Then also in which day the correction is done, that day also should be mentioned, and also we can provide the reason for the correction also. So this correction of the document, it can be do by the investigator or any authorized person as per the delegation law who are authorized to be do these activities now, they can do it. Okay, so I will show you a demo.
Ma'am, we don't overwrite here, na?
Yes, we cannot do any
Overwrite is a
overwriting or any, usually what we will do, we may do any multiple lines over the mistake, or we may use any whiteners, right, for doing the correction. That type of the activities, it cannot be used here. Okay. Okay, suppose if it is just a date. Okay. So there is an suppose we giving the date of birth. Okay. So as per the source document as per the source document, this is the date. So when we check the later, we understood that there is a mistake in the year. Okay, first is 1996. Then when we again check that, we identified that there is a mistake in the year. So actual date is 7. So how we can do the correction? Can you help me? How we can do the correction?
Sorry, ma'am.
How we can do the correction? I have to be correct this this year 1996. I have to be
Ma'am,
correct.
ma'am, that is one stroke, ma'am.
Sorry.
One stroke.
One-
Ma'am, we have to
yes.
put one stroke line.
Yes, I have to be just give a single straight line, right?
And give this abbreviation number.
This is just a single straight only I have to be give. Sometimes we may do like this multiple lines. We can't do like this. Okay, just give a single straight line only, because what is the first information? It should be clearly visible. Okay, what is the first information? Now it should be clearly visible. So just give a single straight line only over the mistake. Understood? Then after that, what we have to be do next? We have to be
Give a number 1.
not number. The correct one we have to give. Then along with that, this is my short signature. Okay, can you see? This is my short signature, initial signature, SJ. Can you see this one?
Yes.
Yes, ma'am.
This is
Yes,
my
ma'am.
signature.
Yes, ma'am.
Okay, then I give my initial signature, like my short signature. Then after that, now I have to be give the in which day I
Date.
done this correction. Yes, so today I done the correction. So I have to put today's date, the full date. Okay, including year, month, everything we have to be provided. Understood? Then here we have to be provide the correct. Okay. Understood?
Yes, ma'am.
Like this way we do the documentations. If you done any mistakes in any paper document, this is the way to be corrected. Understood? Clear?
Yes, ma'am.
Okay.
Yes, ma'am.
But this is the case of the paper one. So if you done any mistakes in any electronic document, for example, if you done any mistake in CRF, how you can do this correction? If you done the mistakes in ECRF, how you can do the correction?
Ma'am, we can highlight the mistakes and not order.
No. Usually there will be an editing options will be there. Okay. So suppose if you done the data entry in a CRF, then after that, once you done that data entry, we will give a submit option. Okay, then after that you understood that there is a mistake in the mistake in the any data. So what you can do, usually that electronic system or CR or any other system, that will be contain an editing option. Okay, so when you done this editing option, you will be when you click on this editing option, you will be able to do the editing of the data. Okay, then after that, when you click on this editing, when you done the editing now, it also will be contain a question will be there. There will be a question will be, you can say near to that. Okay, why you are changing the data? Why you are changing the data? So there will be a drop down options will be there, and in that drop down option, you have to be give the answer why you are changing the data, like due to any data entry error, or due to it's a new data, or as per the query, like that certain options will be there. So you have to be select the proper option for this, why you are changing the data. Understood? Editing option, give the correct data, then provide the reason for this. Understood? Then we can say submit our data. Clear?
Yes, ma'am.
Yes, ma'am.
So here we are not doing any signatures. We are not providing any data, providing any date of the correction. Do you know why? In the paper, we will give everything, the signatures with the date. But in the electronic, we are not giving. Why?
Because maybe it will be system generated.
It will be, system will be automatically give this information. The system will be automatically, the system have the capability automatically to keep this information that who done the changes, when done the changes. So how the system can recognize that this person done the changes? How the system can recognize it?
There will be a logging ID for every individual. Then they will
Yes,
log.
absolutely. There will be a login ID. When you are using an electronic system, there will be a login ID. When you are using our email, we will have a login. We will have a user ID and password, right? So like that, when you are using our ECR, they will be have a unique user ID and the password will be there. So by using that, the person who done the login, the system can be identified. So that under that thing, it will be automatically recorded. This person done the changing of the data, and system will be automatically record the date and time also. Understood? So like that, we are doing any corrections in the documentation. Clear?
Yes, ma'am.
Yeah. Then next information which they are given, it's about electronic data processing. Okay, electronic data processing. So this electronic data processing, here it's mentioned that for electronic data processing, only authorized person should be allowed to enter, or they should be only allowed to be modify any data in the computer system. Only allowed person can enter, like the one who is authorized to be do, who have the login details, that person only can do any data entry, or that person can only do any changes or any modifications in the data. Okay, so the same thing which I already told in the corrections, the system, they will be record this information, who done the changes, when done the changes, why done the changes. The systems will be have the capability to record this information, which is known as audit trail. Okay, and also for this electronic data system, there will be a security system should be there, which is to prevent any unauthorized access to the data. Okay, so what they are usually doing, they will be give the login for the authorized person. And can we share these login details to any other one?
No.
No, it's prohibited. The login ID, what are the login details? It cannot be shared to any other person. Okay, and also the sponsor, they have to be keep the list of the authorized person who can make any changes in the system or make any changes in the data. They have to be maintained the list of the person who can do any data entry or who can do any changes in the data. and always they have to be keep the adequate backup of the data. Sponsor have to be keep the backup of the data. Why they have to be do the backup of the data?
To
For the
avoid
proof.
any loss